Hi everyone. Today our class is on X-ray films. The learning objective is to learn and understand about the contents of a film packet, the composition and use of each component, and also the type of X-ray films. X-ray film is the film image receptor system which is used in radiography. The first X-rays were recorded on glass plates which were coated with emulsion on one side. X-ray films help to record information regarding the structure through which the X-ray passes. Coming to intraoral films, these are films which is placed inside the mouth during X-ray exposure. The components of X-ray film packet consist of an outer packet, lead foil sheet, black paper, and X-ray film. These are the separate views of each component: X-ray film, black paper, lead foil, and outer packet. Coming to the function of each component, the outer packet seals the film. It is moisture-proof, light-proof, and the side of the packet facing the X-ray beam is white and smooth. The black paper covers the film and also shields it from light. The lead foil is positioned just behind the film, and the function is to shield the film from scattered secondary radiation. And the film is exposed with the foil on the back side of the opposite side of X-ray tube. This is a cross-sectional view of an X-ray film. It has got a plastic base and is with emulsion coated on both sides. These are each layer of the X-ray film in the cross-section: the base, adhesive, emulsion, and supercoat. The base, which is around 200 microns. The emulsion with the adhesive, which is around 5 to 10 microns. The X-ray film consists of a base, adhesive, and an emulsion. The base, which consists of polyester, polyethylene, terephthalate. That is the composition of the base. Also, the film has got an adhesive to which the emulsion is attached to the base. The emulsion consists of silver halide grains with the vehicle matrix. Composition of X-ray film: the base, which consists of polyester, polyethylene, terephthalate. It provides strength and support to the emulsion, and it is around 200 microns thickness or 0.2 mm thick. The adhesive, which is attached to the emulsion, which attaches the emulsion to the base and is applied on both sides of a film. The emulsion records a radiographic image, and it consists mainly of silver halide crystals. And the emulsion is sensitive to both the X-rays and visible light. The protective layer, the outermost protective layer, protects the emulsion surface from mechanical and processing damage. Now coming to classification of X-ray films. Based on use, it can be divided into intraoral films and extraoral films. Based on the coating of emulsion, single-sided emulsion coated films and double emulsion coated films. Based on the exposure mean, direct exposure films and indirect exposure films. And based on the speed, X-rays can be divided into slow films and fast films. Based on the screen used, X-ray films can be divided into screen films and non-screen films. And also based on packing, X-ray films are divided into single film packet and double film packet. So coming to the classification of X-ray film based on use, intraoral films and extraoral films. This is based on the placement of the X-ray film. When it is placed inside the mouth or inside the oral cavity, these are known as intraoral films. And there are films, X-ray films, that is used or placed outside the mouth, and these are the extraoral films. Based on the emulsion coating, X-ray films are divided into single emulsion films and double emulsion films. In single emulsion film, above the base, that is polyester plastic base, only one side of the base will be coated with emulsion. And in a double emulsion film, both sides, upper and lower surface, will be coated with the emulsion. Based on the exposure, direct exposure films and indirect exposure films. Direct exposure films are also known as non-screen films. In these, only the film is used and an extra screen is not used. Usually, this is used in intraoral films. Indirect exposure films are also known as screen film or screen film combination. In this, along with the X-ray film, an extra screen is used. An intensifying screen will be used, and these are usually used for extraoral projections or extraoral radiography. And the screen films are used in pairs, that is, it will be covering both sides of the film. Based on the speed, X-ray films are divided into slow speed films and fast speed films. We have got speed from A to F, that is A, B, C, D, E, F. A, B, C films are considered to be slow speed films and D, E, F are fast speed films. And the difference comes in the grain size. ABC films or small speed films consist of small grains or silver halide crystals, and they have got better definition, but it has got the disadvantage of more X-ray exposure time. Fast speed films, the DEF films, are included under the fast speed category. These indicate the ultra speed films, ecta speed films, and the ultra ecta speed films. And we normally use the E speed films or the ecta speed films. And these have got larger grains compared to the slow films, but the exposure time is less. Based on the packing, we have got single film packets and double film packets. Usually for intraoral radiography, we use single film packets. And this consists of in the composition or contents of the film packet, only one X-ray film will be placed inside the packet. These are used for intraoral radiography normally. And in double film packets, there will be two films which is placed inside the packet. And this is used to produce two identical radiographs with the same amount of exposure, which is necessary to produce a single radiograph. And this is used in duplicating films. So, an intraoral film is a film that is placed inside the mouth during exposure and is used to examine the teeth and the supporting structure. And we have got from sizes 0 to 4. Size 0, size 1, size 2, size 3, and size 4. These are about the intraoral films. Intraoral films are used as periapical radiographs, white wing radiographs, and occlusal radiographs. Periapical radiographs are used to learn about the periapical region of the teeth. And we have got from sizes 0 to 2, that is 0, 1, and 2. Size 0 film has the size of 22 into 35 mm, and these are used in children. Size 1 film are used for narrow anterior region, and the measurement is 24 by 40 mm. And we usually use the size 2 film or the adult film to record the posterior teeth, upper and lower posterior teeth, and the measurements are 31 into 41 mm. Then we have the bite-wing radiograph, which is a bit larger than the size 2 film, and it measures about 27 into 54 mm. Then we have got the larger sized occlusal film that is used to record a larger area, including a complete arch, that is around 57 into 76 mm. Now we have the recordings in an IUPA, bite-wing and an occlusal film. The first image is a size 2 film, which is used to record the adult posterior region. We can see the crown and the root structure and also the periapical region. So the name intraoral periapical radiograph. On the right side, upper right side, we can see a bite-wing radiograph, which records the upper and lower teeth along with the crown and a part of the root. Also, we can see the bony crust. Next, we have the pediatric film or the size 0 film, and these are used in child patients, which can be used for bite-wing and also for recording the periapical region. Next, we have the size 4 film or the occlusal film, which is used to record a larger region. Like here, we can see the maxillary teeth. These are the different sizes of the film shown. Next, the extraoral radiographs. We have two sizes for extraoral radiographs. That is size 6 by 12 inches, which is used for panoramic radiography, and the 8 by 10 inches, which is used for cephalometric radiography. The extraoral radiographic films are used for imaging the skull temporomandibular joint along with the jaw bones. That is, a larger part of the skull along with the teeth can be recorded. Now we have got the image of a panoramic radiograph, which with a film size of 6 by 12 inches, and also the cephalometric radiograph with a size of 8 by 10 inches. So this was about the radiographs used in dentistry. Thank you.